I'm a colorectal surgeon, so we treat patients who have colorectal cancer, inflammatory bowel disease like ulcerative colitis or Crohn's disease, diverticulitis, and then sort of hemorrhoids and anal fissures and things like that. And we also perform colonoscopies for screening purposes. I went to medical school, I thought I was going to do primary care, and ended up really falling in love with surgery. And colorectal surgery for me combined those interests, because there are these things like screening colonoscopy and what feels like surgical primary care with hemorrhoids and things like that, but then also really uses pretty advanced surgical techniques with robotic surgery, endoluminal surgery, other minimally invasive techniques to provide really high-level specialized surgical care. And so for me, it combined a lot of those interests. And I also enjoyed taking care of patients with cancer, but didn't only want to do cancer, and found it also really rewarding to take care of younger people who have chronic diseases like Crohn's disease or ulcerative colitis, and treating sort of a full range of a variety of patients and pathologies. In colorectal surgery, we can deal with some sensitive subjects, and so a lot of the visit is making the patient feel comfortable with what we're doing, explaining it before we do anything to make sure that they are comfortable and know that what we're going to do, and so they can have some anticipation of that. And then once the exam is done, we talk about what our next steps will be, if we need to get more information in some kind of test or imaging, or if we can make a plan on that day for what to do. And sometimes we can even do a procedure or treatment in the office, and so that we can be done with their complaint when they come. One of the things that I really like about colorectal surgery is that we have both of those interactions. We can have patients who I see them only one time, and we're able to address their complaint in that visit, and then I don't need to see them again. They can certainly come back if they have further questions, but sometimes we can deal with the issue on that day. But then there are patients that we end up seeing for years for their chronic disease, or for patients who have cancer when we surveil them after their treatment is done. Some of my favorite things to do are to be outside. I really like hiking and camping and backpacking, things like that. So getting outside, I really enjoy that. I really enjoy traveling internationally and seeing other places and different cultures.